The symptoms of stroke depends on which part of the brain is affected. So certain parts of the brain controls feelings or sensations, certain part of the brain controls movement, certain part of the brain controls speech. So depending where the stroke has occurred, you get a conglomerate of symptoms. So some patients will present with weakness on one side of the body, complete loss of sensation, and slurring of speech. Others may present with gait instability. They find themselves very giddy, posturally unstable. They are unable to walk in a straight line. Some may have loss of consciousness. So stroke can present in many different ways, but the hallmark of stroke is typically an acute event. It happens suddenly. It doesn't take days to occur. The event occurs suddenly where you find yourself suddenly incapacitated, completely numb or completely weak, or suddenly unable to talk. It's not a symptom that develops over days or weeks. I think everyone in Malaysia should be able to know how to spot a stroke. It can occur to your family members, to your work colleagues, it can occur to anyone around you. One of the best ways to spot a stroke or to identify that someone is having a stroke is to understand the mnemonics, which is BEFAST. B stands for balance, sudden loss of balance. E stands for eyesight, you get blurring of eyesight, vision blurring, or you find your eyes squinted. F means weakness or numbness in your face. A means weakness and numbness in your arms. S means speech slurring. You find yourself unable to talk. And when you have B, E, F, A, S, you must remember that T refers to time. Time is of essence. When you have a stroke, the most important factors when it comes to recovery from stroke is how fast you treat the strokes. So time is of essence when anyone around you has those symptoms that I've just spoken to you about. The first thing you need to do is to come to the hospital immediately. If you're on your own, then call someone who can get you to the hospital or call the ambulance services. If any of your family members or your colleagues at work exhibit the symptoms, then the first thing you should do is just get them to a car, get them to the hospital as soon as you can, or get an ambulance to your center so that treatment can be started immediately.